The title for this journal is The Changes in Air Pollution Levels After COVID-19 Outbreak in Korea. It was published in 2021 and the author of this journal are Min Jae-ju, Jae-hyun-oh, and Yoon-hyung Choi. At the end of 2019, a series of pneumonia of unknown cause emerged in Wuhan, China, was identified by its association with a novel coronavirus. In South Korea, the first case of COVID-19 was confirmed on January 20, 2020, and the number of confirmed COVID-19 cases sharply increased. In order to control the spread of COVID-19, Korea's Central Disaster and Safety Countermeasures Headquarters on COVID-19 promulgated social distancing, followed by stronger social distancing, and provided government action as well as guidelines for the public, and in accordance with planned government action, postponed opening of the new school year and encouraged telecommuting. That action in turn resulted in a reduction of industrial operation and traffic than normal. Although the social distancing and reduction in human activities after the COVID-19 outbreak may lead to the side effects of decline in economic growth, social distancing after COVID-19 outbreak may also have a certain positive side effects in levels of air pollution. In particular, the study focused on the most important air pollutants in Korea, which is PM2.5, PM10, and O2, and also CO that are related to industrial activities and traffic. The study evaluated the daily variation of nationwide air pollution between December 1st until April 30th, which is from the global onset of COVID-19 to the social distancing period in Korea. The study also evaluated the year-to-year difference of monthly air pollution compared to the previous 3 years and regional variation during the social distancing period by comparing to the same period on previous years. This study aimed to investigate changes in air pollution of particulate matter with aerodynamic diameter less than 2.5 or 10 micrometer, which is PM2.5 and PM10, nitrogen dioxide and O2, carbon monoxide CO during the social distancing period after COVID-19 outbreak in Korea.
Hi, my name is Fadzliana and I will discuss about the methodology, data collections and analysis. So there are 4 elements we use, including COVID-19 data collection, air pollution data collection, analysis, and sensitivity analysis. Coronavirus disease COVID-2019 situation reports of WHO. We use to compare data on confirmed COVID-19 cases in each nation, including Korea, the United States, and China. In South Korea, the Korean Centers for Disease Control and Prevention (KCDC) and the Korea Ministry of Health and Welfare COVID-19 Central Disaster and Safety Countermeasures Headquarters provided detailed information on COVID-19 alert levels and social distancing. For air pollution data collection, Korean Ministry of Environment provided air pollution data collected by 446 monitoring stations from December 1 to April 30 over the past 4 years to map background air pollution in Korea. National Institute of Environmental Research 2019 stated that monthly mean air pollution was calculated for each month's average. Monthly mean was not calculated when the number of available daily measures was less than 75%. SAS software was used to undertake statistical data analysis. Statistical significance was defined as a value of P less than 0.05. All air pollutant concentrations were normally distributed, and the mean and standard deviation (SD) were used to describe the concentrations. A graphical model was created using a geographic information system by QGIS software to depict regional variance in air pollution levels. For sensitivity analysis, 2 less important air pollutants, sulfur dioxide and ozone, were investigated, and variation in sulfur dioxide and ozone levels on the same day in the current year, which with each prior year, were compared using a paired t-test.
Hi! For the result, Figure 1 shows daily change in total number of confirmed COVID-19 cases between 1st December 2019 and 30 April 2020. In Korea, The COVID-19 date of onset was on 20 January 2020 when the first case was confirmed in an imported person from Wuhan, China. The number of confirmed cases in Korea increased gradually until mid-February, but the number sharply increased after 18 February 2020 with a regional outbreak from the religious cluster in Daegu metropolitan city. 11 cases by 31 January, 3,150 cases by 29 February, 9,786 cases by 31 March, and 10,765 cases by 20 April 2020. Next, for Figure 2, it presents a daily change of air pollution between 1st December and 30 April over most recent 4 years. Around the first onset of confirmed COVID-19 cases, which was on 30 January 2020, ambient PM2.5, PM10, nitrogen dioxide, and carbon monoxide concentration began to reveal slightly different from those in 2018, 2018, and 2017. After the regional pandemic of Daegu City and social distancing, ambient concentration levels were substantially lower than level in previous years. Last but not least, for the Figure 3, present monthly mean concentration of each air pollutant in December to April over since 4 years. In December 2019, PM2.5, PM10, nitrogen dioxide, and carbon monoxide concentration show no significant difference with the 3 prior years. In January and February 2020, their monthly mean were significantly lower than those in at least 1 prior years. In March 2020, their monthly mean were statistically lower than those in all prior years. And in April 2020, their monthly mean were significantly lower than those in at least 2 prior years. Particularly, in March 2020, immediately after social distancing, the monthly means of PM2.5 was 20.39, which was significantly lower than the monthly mean of all 3 previous years, which were 34.23 in 2017, 28.65 in 2018, 37.37 in 2018. For PM10, the March mean was 39.19, which was significantly lower than 54.67 in 2017 and 60.77 in 2018, while for the mean in March for nitric dioxide was 60.22 and for carbon dioxide was 0.424, which were significantly lower than the previous year. Compared to March 2019, 1 year before, the nationwide mean concentration of March 2020 decreased by 45.45% for PM2.5, 35.56% for PM10, 20.41% for nitric dioxide, and 70.33% for carbon monoxide. Result for years to years comparison of March mean between 2017, 2018, 2019 and 2020 years are shown in Table 2, and result for December, January, February, and April's mean are in Supplemental Table 1, 2, 3, and 4.
The study focused on ambient PM2.5, PM10, NO2, and CO that are found as major air pollutants related to industrial energy consumption and traffic volumes. A significant reduction trend was observed in all PM2.5, PM10, NO2, and CO levels during the social distancing period compared to the same period in previous years. In March 2020, after social distancing started, the national average of ambient air pollution revealed a significant decline of 45.45% in PM2.5, 35.56% in PM10, 20.41% in NO2, and 17.33% in CO levels compared to March in the previous years. This reduction in air pollution is possibly due to the reduction in domestic sources after Korean COVID-19 onset and additionally due to the reduction in transboundary pollutants after the Chinese COVID-19 pandemic. After the outbreak of COVID-19, all levels of human activities were reduced, including operation of industrial facilities, traffic, and individual activities. After the COVID-19 outbreak in Korea, people began to minimize social gatherings and avoid visiting crowded places. Since the social distancing and stronger social distancing was implemented, people refrained themselves from going out except for essential situations. Indeed, in the first week of March, immediately Immediately after beginning social distancing, the volume of road traffic and public transportation in Seoul had decreased by 7.2% and 34.5% compared to the weeks before the COVID-19 outbreak in Korea. The COVID-19 crisis has allowed an opportunity to evaluate effects on the ambient environment from reducing the industrial activity and traffic. These findings of significant reduction in air pollution, which is ambient PM2.5, PM10, and O2 and CO in Korea after social distancing during COVID-19 outbreak, is such a regional example towards clean air. However, the study also supports the need to further reduce current levels of fossil fuels consumption in order to control air quality more effectively.
As conclusion, air pollution is a pollution that we need to be aware, although it's not the only problems that need to be addressed when health-related issues are overcome, but all the consequences that will arise from our shift in priorities without thinking in the long run will give a big impact to our environment. The COVID-19 crisis has allowed us an opportunity to evaluate the effect on the environment from reduced industry activity and traffic. Social distancing have a certain positive effect in level of air pollution and cause reducing air pollution in a sustainable post-COVID-19 world. That's all from us. Thank you for lending me your ears. Bye!